Ladies and gentlemen, my name is Stanisław-Radoń and I am an orthopedic surgeon. Work and inventions are my passions in life. I have already got 17 patents, and these are patents that apply to various fields. Today I want to demonstrate a patent invention in the field of medicine. It is a stabilizer for scoliosis treatment, both for adults and children. The stabilizer grows with a child. After I had obtained that patent, I visited Professor Zarzycki at the second orthopedic clinic of the Jagiellonian University and asked him for the evaluation of my stabilizer. After I had finished my presentation, Professor Zarzycki exclaimed, "Doctor, you have created the first dynamic spine stabilizer in the world. You have recreated a physiological spine. I was happy to hear such words about my invention. Now I want to show you the details of my patent and explain how it works. Well, I have invented two types of segments that I want to show. One segment type has a rod with a round hole and the other type has a rectangular hole. One segment type has a neck with a head ending, and the other segment type has a rectangular shaped neck with a flattened head ending. When inserted into the spine during surgery, these segments together with the spine allow us to perform movements in all planes, that is, in the sagittal plane, forward and backward movements, in the frontal plane, side-to-side movements, and rotation movements in the transverse plane. Rotation movements show a greater range of motion that a human being can perform, and it can be explained by the fact that the head moves sideways and in a circle. If it is possible to correct the entire abnormal curves of the spine during the operative procedure, then we will obtain normal curves and preserve kyphosis and lordosis of the entire spine, and can be seen in my exhibit. To give an example, if scoliosis involves the thoracic section of the spine and it has reached 8 segments, then during surgery we use the 2 more segments, one at the top and one at the bottom, and these are final segments to which others are tightened. The movement of the spine that children make when performing bridge exercises, the movement in the other direction, there is no return of scoliosis at all. Touch your finger now. It holds. Scoliosis is not possible now thanks to the segments that block the return of abnormal curves, and rotation movements in these segments are preserved.
Blokują powrót do skrzywienia, a ruchy obrotowe na wyżej wspomnianych segmentach są zachowane. Pokażę to.
I will explain it starting from the top between TH1 and TH2 rotation movement. The same rotation motion occurs between th12, L1, the head rotates, and such rotation motion is observed at the L5 level and an additional segment attached to the sacrum. And if the curve cannot be corrected completely because it was very large and old, then we have to go around that curvature, which you can see here while looking at the exhibits showing thoracic and thoracolumbar scoliosis. We have to go around that curves using segments containing heads. The benefits of such a spinal stabilizer are enormous. First of all, benefits for the child. Surgery can be performed only once. There is no need for repeat operations because the spine with the stabilizer grows with the child. If the child's spine grows 1 millimeter over a period of time, then my stabilizer will extend by 1 millimeter. If it grows 2 millimeters, a child growing rapidly, then the stabilizer will also expand by 2 millimeters, but mobility is preserved and bending and straightening movement are preserved, which eliminates pain, arthrodesis and stiffness.
Artrodezy, usztywnienia, jakie są wykonywane do dnia dzisiejszego operacje na kręgosłupie.
A stabilizer is inserted during the operative procedure, and I want to emphasize that the stabilizer has the same range of motion as the patient's spine and a greater range of rotation movements than a normal spine. The stabilizer is attached to the spine with only one screw per each segment. In the case of thoracolumbar section, the last segment attached to the sacrum can be fixed with 2 or 3 screws. The others do not require more fixation, only 1 screw per each segment. Up till now, surgeries have involved the implanted wires, which have been expanded by an electromagnetic field every few months. It has been necessary because the child grows. As I have already mentioned, the benefits of my stabilizer are enormous. First of all, surgery is performed only once when the child is 12 or 13. There is no need to repeat it several times because the stabilizer expands as the child grows, and when people get older and their bodies get smaller and shrink, my stabilizer also gets smaller and slides inward. And the child enjoys mobility and fitness. She does not feel any pain and her comfort of life is secured. The exhibit demonstrates that scoliosis is eliminated and the curvature goes back to normal curves of lordosis and kyphosis. A scoliosis curve has been eliminated as shown on the drawing. we can see that sometimes, as a result of the age of large degenerative changes, it is impossible to restore the normal curvature of the spine, and scoliosis does not allow it. And then we have to go around this curve, as you can see, at the thoracic level, and the scoliosis curve at the thoracic and lumbar levels. Using segments with the head, we encircle the remaining curves, but it does not prevent us from taking rehabilitation later. It does not complicate anything. We have to go around these curves because if we pulled by force, we would pull the roots of the spine. So we have to bypass them and go further, and the curve must be secured.
Którą żeśmy udoczyli, dalej normalnie prowadzimy i zabezpieczenie przed powodem skoliozy w normalny sposób. Mamy ten odcinek tam, obejście i dalej prowadzimy normalnie. Tu odcinek piersiowy też pokazany.
I kindly request the companies manufacturing devices for scoliosis treatment to implement my stabilizer for scoliosis treatment for production, so as to help people from all over the world. Thank you.